Good morning, everybody. Scott Maybor here with your Medicare Missive from the pond for Friday, the 27th of June. I can't believe the end of June is here. Crazy weather, but absolutely gorgeous morning. So, wasn't going to take a walk. I have some calls I need to make, but figured it's too beautiful to pass up. So I'm going to keep it relatively short. But was at a networking event last night and was speaking to an attorney who I don't know personally. He's in the group, I'm in the group, but he and I have never actually spoken one-on-one. And a couple of us were just having a conversation, and he mentioned that he was 66 or 67, but doesn't care about Medicare because he's on his firm's plan. And again, he's an attorney, he's a partner in the firm. And I said, okay, great. And he said, yeah, I really like the insurance that I have with my with the firm. It's really good. I'm very happy with it. So I'm not doing anything with Medicare for a long time. And I said, okay, great. How big's the firm, by the way? Just asking how big's the firm? And he said, oh, we're down to about 15 people total, including admins and everybody. And I said, you need to be on Medicare. And he said, what are you talking about? And I said, the rule is if the employer is smaller than 20, the group plan is secondary coverage to Medicare. Meaning you need to have a Medicare plan. You can keep the group plan, though it probably doesn't make sense from a cost perspective, but you need to have Medicare. He said, you're absolutely out of your mind. I showed him on the CMS webpage where the rule is, and I said, don't take my word for it. Call Medicare if you want. Call Medicare, do your own research, but that's the rule. If you work for a firm or your spouse works for a firm that's providing the insurance and that firm is less than 20, you need to have Medicare A and B, and you need to be paying for Part B. What will happen if you don't is, if God forbid something really bad happens to you and you have a huge medical bill, your insurance company, the one that you're currently on, could look and say, you should have been on Medicare. Medicare would have paid 80% of that bill. Our responsibility is 20%. You pay the 20, or we'll pay the 20. You pay the 80% that Medicare should have paid that you don't have. So be careful. Again, you can do your own research, but I will tell you what the rule is, and that's how we protect our clients from huge potential liabilities. Now, he could sign up for Medicare and keep the group plan, depending on what he pays for it, the parameters of that plan. Sure, you can do that. But if you're paying a lot of money, $1,000 a month or something for a group plan, does it really make sense to stay on it with a deductible and co-pays when you could be on a supplement for a couple $100 a month? It's his choice. He could also be on an Advantage plan for nothing a month, but he will have to pay for Part B, and I'm guessing his income exceeds the threshold, so he will pay a surcharge on it, the IRMA surcharge. So be aware of that. If you are self-employed, if you work for a small firm, and you are on the group coverage, be careful, because the rule says if it's less than 20, you need to be on Medicare, period. There's no gray area there. You need to be on Medicare. And there's that 80% exposure that Medicare would have paid 80% of the bill, but you don't have Medicare, so who's paying the 80%? And if it's a big enough bill, I guarantee your insurance company is going to say it's not us. The other interesting thing is I was on a webinar with a carrier, actually not with a carrier, with a wholesaler yesterday. There's a lot of changes coming. There's a lot of changes coming with supplements. They're expecting very big price increases. For good or well, not for good or bad, but for bad. But they're expecting the prices to go up. That the prices have been artificially kept low, and you may not think $200 a month or whatever it is in your state is reasonable. It's going up, and I know I've had calls from people when their plan renewed in May, saying how much more expensive it was. The other question, so if you are on a supplement, is now a good time, because supplements don't have open enrollments, is it a good time to look at a Plan N? Can you qualify for with underwriting? A Plan N could save you a bunch of money. Should you switch carriers? One of the carriers offers a couples discount. Both of you don't need a plan, but if you live with another adult over 18, they'll give you a discount. I can't promise the discount will remain forever, but it could save you quite a bit of money actually up front for as long as it's available. Drug plans are changing dramatically. Most of them are non-commissioned at this point, and there's a lot of brokers, and they were advising against it, but there's a lot of brokers who are saying, yeah, I'm not commissioned, I'm not taking the liability on of advising clients on drug plans. Their argument was you're not fully servicing your clients. However, the flip side of that is E&O, errors and omissions insurance usually doesn't cover non-commissioned plans, so that's a problem. 2, it's where most of the time, aggravation, liability lies for a broker. So to offer a plan that you're not covered, you're not getting paid on, especially if that's the only plan you're doing for somebody. So for somebody, if you have a plan and you're happy with it, and you say, well, I just want to do an annual drug plan review, you may find it hard to find people willing to help you with that. It's just the reality that you're asking somebody to do, some work and not get paid for it. So I don't know where that model's going. And then with Advantage plans, you're going to see a lot of cutbacks on the extra benefits. Probably increases in copays, increases in drug costs. The annual cap is going up only slightly. I think it's $2,100 next year. But you'll see formularies rejiggered. So things that were tier 2 will be tier 3. You'll see things like that there'll just be fewer of the really cheap drugs around. Stay tuned. Be sure you check your plans during open enrollment, which starts in October. But don't worry about it until then. If you do have a supplement and you do think it's time to review it, if you haven't, I spoke to somebody who's helping his father, hasn't reviewed the plan probably in 20 years. He's 85 years old. He's like, I have no idea what he has. Probably has had it since he went on Medicare. Review your plans. Have somebody help you review your plans. Can save you a ton of money and also some unpleasant surprises. Have a great weekend, everyone. Enjoy, be well, stay safe. Comments, questions, always welcome. Thank you.